If you haven't had it, you likely know someone who has. The flu season is here in Wisconsin, and it is brutal. The number of cases is climbing, hospitalizations are up. So, what can we do to protect ourselves from the flu? And is there anything you can do to minimize the symptoms if you get sick? Here to offer advice is Dr. Ben Weston. Dr. Weston is the Milwaukee County Health Policy Advisor and an associate professor in the Department of Emergency Medicine at the Medical College of Wisconsin. Thanks so much for being with us.
It's good to be back with you.
Before we dive into a discussion about what's happening, let's start with understanding what the flu actually is and is not. People tend to call any kind of illness this time of year the flu. What are the actual symptoms of influenza?
Yeah, so we hear about the flu and about stomach flu and all these sort of things. So what influenza actually is, it's a virus. It's influenza A is what we're really seeing this time of year. Subclade K, you might hear that term thrown out. That's how it's kind of mutated this time of year. But what is tricky about it is it's similar to a lot of other viruses that are going around. You get the fever, you get the congestion, the runny nose, the cough, all those sort of things. But flu tends to be a bit more severe than the other things going around. It certainly is seasonal, as we're seeing right now, and it's also very preventable with the vaccine and with other public health measures.
One of the things that's happening is that there just seems to be a lot of flu out there, and some experts are calling it the worst start of the flu season that they've seen in decades. How does that jive with what you and your colleagues are seeing? Is it really that severe?
Absolutely. I mean, the flu activity, when we look at the number of actual doctor office visits and emergency department hospital visits in the United States, this is the highest level from influenza we've seen in the last 25 years, which is really saying something. We were talking last year about how severe flu season is, and we're starting off even worse this year. To put it into some context, nationally, there's been over 1 million people sick with the flu, 120,000 hospitalizations, and over 5,000 deaths. Even just so far, we're just getting into the flu season, over 5,000 deaths from flu so far this season. I'll give you one more statistic, and it's in Wisconsin. Nearly 1 out of every 10 people visiting the emergency department, and that's worth repeating, 1 out of every 10 is diagnosed with the flu, no matter what they're there for. They're diagnosed with the flu. And so I'll say when I'm working in the emergency department this weekend, and I'm sure I will be seeing lots and lots of people with flu, and talking to my colleagues in the adult and the children's emergency department, they're seeing a ton.
Why is it so bad this year, so early?
Yeah, it's hard to pin down the exact cause. Certainly part of it is that the flu virus has mutated a bit. Now, it mutates a bit every single year. Things change a little. But this year, it underwent a mutation relatively recently. So what that meant is that it's harder to prepare for it. And so what that mutation does is it makes it more likely to evade immunity. In part, vaccine immunity. Now, the vaccine still has a pretty good level of effectiveness, and we can talk about that, but also prior immunity. If you've had the flu in past seasons, you usually keep some level of immunity so that you can fight it. But with this latest mutation, it really overcomes a lot of that, which makes you more likely to get sick and more likely to get severely ill, especially if you're in those higher risk populations.
Let's talk a little bit about the vaccine. You always say, get that flu vaccine. But if someone hasn't gotten it yet, can they still get it and hope to stave off the worst of the flu if they do contract it?
Yeah, so the short answer is yes. The longer answer is we recommend everybody gets their flu shot by the end of October. And the reason why is that it takes a little bit of time to kick in. It takes a couple weeks for that flu vaccine to really kick in, affect your system, and for you to have that full level of immunity from the vaccine. Now, we're late in the season. We're in the beginning of January, so it is pretty late to get that flu shot. But considering we're just ramping up, and we're starting to see the peak of flu season, it's not going to be gone in the next 2 weeks. And so even if you get that flu vaccine today, you will still have immunity when the flu season is ongoing. When we look at other countries to see how good the vaccine was, it still decreased flu-related hospitalizations by 70 to 75% in kids and about 30 to 40% in adults. Is it 100%? Absolutely not. And that has a lot to do with those mutations. But boy, I'll take a 30 to 40% decrease in likelihood of getting hospitalized any day, especially if you're older, immune compromised, in some of those high risk groups. So definitely it's not too late to get the vaccine, but today is better than tomorrow, and tomorrow is better than the next day. So the sooner, the better.
We're just coming off of the holiday season. People are traveling, they're hanging out with friends and family in these tight indoor spaces. What do we think is going to happen now over the next couple of weeks? Because people have potentially had a lot of exposure over the holidays with their family and friends.
Yeah, we're seeing that ramp up, and I think most people listening to this know somebody who's been sick and probably sick with the flu, whether they tested positive or not. It seems like everybody's getting sick right now, and so I think we'll continue to see that for a little bit. I don't think we've seen the end of the peak of the flu season. I think it'll continue to go up. That's why it's still valuable to get your vaccine at this point. Sometimes when we see these steep peaks of increases, we also see pretty quick decreases. We can keep our fingers crossed that that's the case. But either way, there's a lot of influenza going around right now. And so take precautions, and the best precaution to take is still, even though it's late, to get vaccinated.
Okay, so let's say someone did not take your advice, they didn't get vaccinated, they get the flu, they're really feeling horrible. What types of things can you do to decrease the symptoms that you're having?
Yeah, so whether you got the vaccine or not, if you get the flu, there are certain things you can do to decrease your symptoms. Of course, there's the standard sort of thing: staying well hydrated, resting, taking Tylenol, taking ibuprofen. That'll help you to feel better throughout the day. Now, if you're in one of those high risk groups in particular, if you're older, if you're very, very young, if you have various immune compromise or respiratory conditions, you definitely want to think about getting Tamiflu. Tamiflu is a medication that actually fights the flu. It shortens the duration of your flu symptoms, and it decreases the likelihood of severe disease, getting hospitalized, having prolonged illness. And so if you are especially early on in your flu symptoms, you may want to seek out Tamiflu. It's a prescription medication. Any healthcare provider or physician can prescribe that as well.
While we have you here, we do want to talk about a change in vaccines, a change to the recommended childhood vaccines that just came out from the Centers for Disease Control. That change includes a recommendation that kids no longer get the flu vaccine. What kind of impact is this change going to have on families as they try to figure out the best way to protect their children?
Yeah, so what we saw was a reduction in the total number of required vaccination shots. It's reduced from 18 to 11. It's a pretty big reduction. It includes some pretty major vaccines: RSV, hepatitis A and B, meningitis, flu, and COVID vaccines. They're all categorized under this not required but shared clinical decision making. It means go in, have a informed discussion with your physician to decide whether these vaccines are beneficial for you or not. What is challenging when we hear these recommendations is that these are decades old proven vaccines that in many cases, you take hepatitis B, for example, have nearly eliminated this illness that used to affect thousands of children, leading to liver cancer, leading to death, meningitis, flu, as we're talking about right now. Look, when we talk about vaccines, we've talked about this for a long time. We want it to be low barrier. We want it to be a very easy thing that you can do. You go to the grocery store, you swing by the pharmacy. You go to your doctor for your annual physical, you get your updated vaccines. It should be low barrier. It should be easy because we're protecting people from what are severe, preventable diseases. And by doing this, it makes access more challenging. We know that not everyone, in fact, many, many people in our society don't have the luxury of saying, I'll swing by my doctor's office next week and have a long discussion with my physician about whether these vaccines are best for me. And clinical trials show that these vaccines are best for just about everyone, including society at large, to prevent the spread of these diseases. So it is disheartening. I hope folks continue to get these vaccines, but certainly we're going to see less and less people doing so.
Well, Dr. Weston, we really appreciate you being here with us and helping us understand the complexities of these changes, but also giving us some really good advice on how to stay healthy during flu season. Thank you.
It's good to see you. Take care.
You too. We are right back.